In the middle of Ian, Lee Health had to close hospitals. That caused a nightmare for patients and caregivers.
Yeah, but like so many of us, Lee Health is learning from Ian. And Wink News anchor Nicole Gabe tells us how Lee Health has already prepared for the next time.
We know how Hurricane Ian ripped apart neighborhoods and destroyed businesses. What we have not talked about much is what the storm did to hospitals.
The worst thing you can do during a storm like this is evacuate a hospital, because that's when the people need you.
That's what Lee Health had to do during Ian. 416 patients had to move, 90 of them kids. Among them, 5-month-old Jaira, who had RSV. They were at Health Park Medical Center. Wink News highlighted his experience after Ian passed through.
He had moments that he felt like he couldn't breathe, and his chest was squeezing down what felt like as flat as a pancake.
Nikki Escobar is Jaira's mom. You may know her as First Lady Nikki on Fly 98.5, a radio station owned by Sun Broadcasting, a sister company to Wink News. Nikki said Health Park had no water. Still, she trusted her medical team and the decision they had to make.
I didn't feel that there was a lack of care or inability for them to completely do their job.
One of the things we didn't anticipate was the loss of water from our municipalities. There were major water main breaks throughout the county, and as a result, that dropped the water pressure.
A hospital just cannot function without water. So even during a powerful hurricane, Nikki and her baby went by medical helicopter to Johns Hopkins All-Children's Hospital in St. Petersburg.
The state ordered an evacuation of the Health Park campus and the Gulf Coast campus, and we did that. We began that evacuation.
We wanted to make sure that we were able to keep our patients safe.
Gloria Graham is Lee Health's security director. She said while floodwater never entered the hospital, the surge filled both the Health Park and Golisano Children's Hospital's parking lots.
We lost over 400 cars in the parking lot. 10% of our staff, 1,400 people, were displaced from their homes. I mean, that's how significant it was.
But it took time to get the hospitals back operating at full strength. Lee Health learned some hard lessons, and now the administration is working on ways to prevent the problems it faced a year ago. Top of the list, ensuring clean water.
Our intent is to install independent wells at each of our hospitals.
We want to be better prepared this year.
They worked so hard during the storm. You know, that transport team, I've had a chance to talk with them. Those helicopters were landing and taking off one after another after another.
Yeah, they absolutely were. And I think a big thing, too, with this story is the question, especially people who either were patients there or if they're working there. Okay, so installing those wells, the leaders that I spoke to say, yes, it's going to take time to install wells at each location. So I asked what's going to happen. I'm told by the leadership that they have already paid for and they have contracted with independent contractors to bring in independent water sources if there was a storm like that ever again, like Ian, and they need water. So they're prepared. Of course, it's going to take some time to get those independent water sources there.
Absolutely.
But yeah,
Water's
they're ready.
so important. But yeah, they're gearing up. Good deal. All right, Nicole, thanks.